Assalamualaikum warahmatullahi wabarakatuh. Me and my friends from group 3 which need to present the communication disorder. So this is our video presentation which is from me Hafiz Al-Qayyim, Muhammad Nabil Aiman, Muhammad Aidil Akmal dan Muhammad Farzlinil. So let's see our presentation. Thank you.
Okay, so we go to the definition first. So, what is communication disorder actually? So, I divide this communication of disorder definition into two definitions. The first one, communication disorder is referred to an impairment of any ability to receive, send, process, and comprehend a written or verbal utterances. The second one, communication disorder also refer the disability in understanding or using language that can impact academic performance and as well as our daily life. So this challenge would probably affect someone academic, social, and emotional damage. Sorry, emotional development. So children with communication disorder also would express their frustration through challenging behaviors such as aggressive behavior and also social withdrawal. So that's all the part of definition of communication disorder. So let's go to the next slide. So let's talk about type of communication disorder. The first one, space sound disorder, also known as SSD. Someone with space sound disorder may have an articulation problem that can affect rhythm, fluency, and length of speech. The second one, language disorder. Language disorder for those who are having an understanding problem there where people may affect morphology, phonology, and syntax of the speech sound or the space. So, language disorder may be divided into expressive and receptive, where expressive means that people are having a problem in express their talk, and receptive mean people having a problem to understand a language. Thirdly, hearing disorder. Hearing disorder occurs in reduced sensitivity in auditory system that can make someone to have a limited vocabulary and also hard to understand the word with multiple meaning. And last but not least is resonant disorder. It results from too much or too little nasal or oral sound energy and mostly is lead to hypernasality and also hyponasality. So hypernasality is when there are too much nasal sound uh, resonate in oral cavity, while hyponasality is too little nasal sound uh, occur in resonate in nasal cavity. So that's all for type communication disorder.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aidil Akmal. Now I will present about learning abilities of communication disorder. Communication learning abilities is divided into two sections, that is expressive and receptive. For expressive, there are four parts. The first one is speech sound difficulties. Students may struggle with producing specific sounds or sound combinations, leading to mispronounced words. The second one is fluency. These fluencies like stuttering or stammering can disrupt the flow of speech. The third one is word retrieval difficulties. Finding the right words to express thoughts can be challenging, leading to delays in speaking or using general terms. The last one is limited vocabulary. Students may have a smaller range of words compared to their peers, affecting their ability to communicate complex ideas. Okay, let's move on to the receptive. There are three parts for receptive. The first one is difficulty understanding instructions. Students may struggle to follow directions especially when they are compressed or spoken quickly. Second one is problems with comprehension. Understanding spoken language, written language, or words can be difficult, affecting their ability to learn in the classroom. And last but not least, difficulty following conversational terms. Students may struggle to understand nonverbal cues or the context of a conversation, leading to misunderstanding. That's all from me. Let's move on to the next speaker.
Assalamualaikum warahmatullahi wabarakatuh. My name is Hafiz Al-Qaim bin Muhammad Yaakob, and today I will present about learning challenge that students face with this communication disorder. Students with communication disorder face many challenges in school. These challenges affect how they learn and how they interact with others. Communication is very important for students because it helps them ask questions, understand instruction, and work in group. When communication is difficult, learning becomes much harder. One big challenge is understanding instruction from teachers or lecturers. If instruction are given too fast or use difficult words, students with communication problem might get confused. They might miss important points or do the task incorrectly. This means they often need things repeated or need help from others. Number two, another problem is joining in activities that involve speaking, which is they are struggle to participate in activities involving communication skill. Some students may have trouble speaking smoothly, like stuttering. This can make them feel shy or nervous, so they don't like to talk in front of others. They may avoid presentation, group discussion, or class debates because they are afraid of making mistake with the problem that they had. Number three, communication problem also make reading and writing more difficult. These students may not understand grammar or sentence structure well, so reading becomes confusing. Writing is also hard because they may struggle with spelling, vocabulary, or organizing their ideas. Lastly, this challenge can make it hard for students to make friends. When someone has trouble expressing themselves, it's harder to join conversation or connect with others. This can lead to feelings of being left out or lonely, and it can affect their confidence and happiness. So, in conclusion, communication disorders can make learning and social life much harder for students. But with support from teachers, friends, and family, they can still do well in school and feel included. We need to be patient and be understanding to help them succeed. So that's all from my part. I will pass to the next presenter. Thank you.
So, we'll talk about the cognitive abilities in communication disorder students. So, attention. So, I will talk firstly about attention. So, attention is a key cognitive skill for communication. Individuals with communication disorders may find it hard to focus on conversations, especially in noisy or busy environments. They might get easily distracted, which means they can miss important details or lose track of what's been said. For example, a child with a language disorder might not respond when spoken to, not because they don't understand, but because they were not paying full attention. Okay, so for the next one is memory. So, memory plays a crucial role in using and understanding language. People with communication disorders may have difficulty recalling words, following instructions, or remembering what someone just said. This can lead to frustration or confusion during conversation. For instance, a person with aphasia might know what they want to say but forget the specific word mid-sentence. And the last one is executive functioning. Executive functioning refers to higher level thinking skills like planning, organizing, and self-monitoring. These abilities helps us manage conversations, stay on topic, and respond appropriately. A person with impaired executive functioning may have trouble starting a conversation, might talk off topic, or not realize when they're being misunderstood. This is often seen in people with brain injuries or developmental disorders like autism. So that's all from my group. We are from group 3, and thank you for watching our presentations.